Treatment of snake poisoning. So, following are the don'ts and do's for snake poisoning or snake bite. So, let's see some don'ts and do's. Take the patient to tantric or a snake charmer for treatment. This we should not do. Suck the wound or cut the wound open. These are the don'ts. So let's see the do's. Immobilize the affected limb. Apply basic first aid. Wash with soap and water. So followingly it consists of field management and hospital management. So let's see in field management. So, in field management, apply splint and immobilize the limb to reduce spread of poison. So, just we need to apply some parallel splint or some wooden stick and make the leg immobile just like we do in fracture. And we should never tie a tourniquet, which leads to hypoxic necrosis of the limb and severely aggravates the amputation process. So now we can see here that a parallel wood or wooden stick is attached to limb to make it immobile. Here we wrap it with some bandage or cloth. Now pressure bandage can be used in elapid bites. So as we know, elapid bites of snakes are like cobras, crate. They are primarily neurotoxic, less local necrotic effects. So wrap pressure must be 40 to 70. Elapid bites are like cobras, as I said it before, and crates, as I said this also, and mambas. Okay, so the wrap pressure must be 40 to 70. According to WHO, we should do the first process in snake poison is right. So now next, hospital management. Once the patient is shifted to hospital, we need to check the following symptoms such as central respiratory, and next goes for wound site, and next for heart and vessels, vision, and other skin sites, muscles, and gastric and intestine. So administer anti-snake venom. It is most effective 4 hours of the bite and can be given up to 24 hours. ASV is of two types. It is basically monovalent and polyvalent. Monovalent is for single species, polyvalent is for several species. The Before administering ASV, we need to do some test dose. The test dose of 0.02 ml of saline diluent ASV is injected into the skin. For 10 minutes, we need to wait and check for redness, hives, and pruritus. If no reaction, then continue AS. If reaction, withdraw the AVS temporarily and give epinephrine antihistamine steroids. ASV further dilute in saline and restart with slower rate. Once we give, then we can start it again. So dosage of ASV. Following are the dosage. If there is local reaction only at the site of bite, then 5 vials are given. If the local reaction as well as severe cellulitis is there, then we should give 5 to 15 vials. If severe reaction and symptomatic examination, 15 to 20 vials. So initially we need to start ASV with 8 to 10 vials, 1 hour duration for rate of 5 to 10 ml per kg, where 5% of dextrose or NS as a diluent is used. Or else we can also do slow injection of 2 ml per minute. So either of these can be done. Either ASV or slow injection directly is given without any IV. Support measurements: hypotension and shock, IV fluids to restore the body electrolytes and fluids levels. Next, TT injection of 0.5 cc intramuscular if not given in last 5 years. When there is a snake bite, there we can see some local tissue necrosis, and this will lead to infection. So to kill that infection, we need to give some antibiotics intravenously. So that is augmentin plus metronidazole. If there is some bleeding manifestation seen at the site of snake bite, then we need to fluid levels will obviously decrease and may lead to shock. So we need to give flesh frozen plasma transplant. If neuromuscular paralysis occurs, neostigmine 1 mg IV stat plus atropine 1 mg IV is given. After half hour, another dose is given, and gradually we need to taper it half hourly, and 2 hourly, fourth hourly. Artificial ventilation should be given if there is respiratory paralysis. If local necrosis is seen, then we need to do surgical debridement and skin grafting so that the skin will heal and there will be less scars and necrosed tissue will be removed. Thank you.